Hello, this is Dr. Trivedi, a doctor working here in this clinic. May I confirm that you are Mr. Jason Earls, 23 years?
Yes, doctor. Yes.
Yeah, Mr. Jason. Today, actually, we are going to discuss about your health issues. Will that be okay with you?
Yes, doctor.
Okay. And during our discussion, I might use some paper to explain some things to you, or I might take down some notes, which this will be very confidential, strictly confidential. Will that be okay?
Okay, doctor. I have no problem with that.
Yes. Mr. Jason, may I know that Jason, how may I address you?
Please call me Jason.
Okay, Mr. Jason. Uh, may I know that how have you feeling? How are you feeling now at this moment?
I am fine, doctor.
Yes, and as far as I reckon that to me, you came to the hospital with some problems in your breathing. Am I right?
Yes, doctor. It is quite a long time. I was actually diagnosed with some heart problem at when I was a child. After that,
Okay.
sometimes I have this type of shortness of breath, and sometimes it goes on its own. Sometimes I need to admit into hospital, take some oxygen, and after that I feel better.
Okay. Okay. And now you are feeling better. It's very good to know that if you allow, Mr. Jason, I might want to discuss about uh, your management plan, or how are you planning? How are we planning to proceed with your problem? Will that be okay, Mr. Jason?
It's okay, doctor, but I feel very good now, and also I asked on doctor that how frequently will I need to visit the doctor. I also needed to visit the hospital after taking oxygen. I felt better, and this time also after taking oxygen, I am feeling better now. But my doctor, when I asked him that how often I will need to visit the hospital or how will it be cured or not, he asked me that he told me that I need to undergo some test, but I don't feel any problem now. So do I need to undergo through this test on? Is it very necessary, doctor?
Yes, yes. Actually, I'm going to explain it to you. At first, if you allow me, may I use the paper to draw a picture to let you explain?
Okay.
Okay. Well, actually, if you just look, this is a chamber. There are four parts in it. Okay. So there are two parts in the left and two parts in the right, and the left part of the heart. This is actually the heart. If you assume that actually the left part, the function of it is to deliver blood to all the body. Okay, and the right part, its function is to send the blood to the lungs to purify it. Okay, are you getting me, Mr. Jason?
Yes, doctor.
Okay, and at times when some people, some persons have some problem with the heart from the very childhood. Okay, in these type of persons, sometimes the blood from this right part can directly go to the left part. Okay, or vice versa. So, are you getting me, Mr. Jason?
Yes, doctor.
So at the time, this can put pressure on the heart, and the function normal activities of the heart can get hampered. So in your case, like you are also a person who are having some heart condition from the very childhood. Am I right?
Yes, doctor.
Yes. So actually, oh, you're feeling very good now, and it's a very good news to know. But if we do the test, the doctor told you about the test, we might be able to know more about your heart. Will you allow me, or do you want me to tell you about the test?
Doctor, I told you that I am feeling fine. Is it necessary to do the test?
Yeah, yeah. I'm very, very sorry, Mr. Jason. But what happens is that actually, if we do the test, we can actually know about the condition within the heart. Okay, you are feeling very well. That's very good news. But the problem is that a good many people can feel very well unless they even when the heart might not be that that very good. Okay, uh, the at times it occurs that a person feels sick when the heart condition is very bad. So we don't want that thing to happen with you. Are you getting me, Mr. Jason?
Yes, doctor. So, what are you going to do?
Okay. Would you like me to tell some more? Tell me some more about your uh, test, about the test that we like to do.
Yes, doctor. I want to know about this.
Yes. Actually, here in this case, we would like to put a very thin tube to the heart, to the chamber of your heart. Okay, specifically the right part. Uh, we actually do it uh, by through your blood channels. Okay, blood channels of the skin. Okay, we enter through the blood channel, and then we go to the heart to.
That means you are going to prick my skin. Will not it be hard, doctor? I am afraid of that.
Okay, I'm very sorry to know, Doctor Mr. Jason. Uh, Actually, it will be very done in a very safe manner, and I can understand that you are very afraid, but it won't be anything very serious. I guess, and I think it will be just be like uh, a bee sting. Okay, uh, will it be okay, Mr. Jason?
Okay, doctor.
Yes. Well, do you want me to continue about the test?
Yes, doctor.
Okay, and actually, after going through the blood channels,
Yes.
okay, so after measuring that we can actually have a far better condition of the. We can know about the heart in a far better way. So, are you getting me, Mr. Jason?
Yes, doctor. Doctor, I am really afraid that you are saying that you will enter a thin wire into my heart, and I am really afraid of that. Don't you have any other alternative? Like I heard that there are some scan that can clearly see the heart.
Okay, Mr. Jason, I I can understand that you are very afraid, and it's actually true, Mr. Jason, that there are also some other options like some scanning. We call it echocardiogram. It's the scanning can also give us some idea about your heart condition, but I think although the scanning can give us that idea, but the test I've been telling about. Okay, actually, sorry, didn't tell the exact word of it. Actually, it's called cardiac catheterization. Are you with me, Mr. Jason? That
Okay,
we
doctor.
want to do that. Okay, that test cardiac catheterization. Actually, that will give us the best picture of your heart. The best we can know about your heart in the best way by this cardiac catheterization, and we can decide on whether or how uh, whether we would have to go some for some more treatment for you or not by doing that test.
Okay,
And
doctor.
are you with
What are the side effects of it? Is there any side effects or any very risk of that procedure?
well actually Mr. Jason, at first I would like to tell you that there will be a very efficient team involved in this procedure, so they will be very capable if any complications arise at all. However, I cannot deny that uh, there can be some risk of complications. It cannot be, it might not be without risk. Okay, there can be some risk. Actually, when we put that tube, uh, there can be some problems while putting the tube. Okay, there can be some bleeding or some infection as well. And also, while we go through to the heart, there can arise some problems as well. But we can assure you that we have a very good team with us, and they will be very much cautious about you. Okay, are you getting me, Mr. Jason?
Okay, doctor. Can I die due to this procedure? I'm really afraid of that, doctor.
Sorry, sorry, I couldn't hear.
Can I die due to this procedure?
Mr. Mr. Jason, actually, the chance of such a severe accident is very rare, Mr. Jason. It's very rare. However, I cannot completely rule out that there are some risk associated with it. And actually, if we measure the benefit of it, it will be far better than your fear, I guess. But uh, it would be very rare, Mr. Jason, this chance that you're telling about. I can understand your fear, Mr. Jason, but it's very rare, and we will be um, very cautious about you. Okay,
How long will
but
I needed to be or admitted into this hospital, doctor?
okay, uh, usually actually it will be dependent. It will depend upon the uh, team, the heart team, the heart doctors team. But usually, if there is no problem present, I think you can go home within the same day as well if there is no problem at all during the procedure. Okay, are you getting me,
Okay, doctor.
Mr. Jason? Well, Mr. Jason, do you have any other concerns?
Can you just give me a leaflet or more time because I am not quite ready to do this test.
Okay, Mr. Jason, you're very welcome to take time. There is no immediate hurry at this moment for you, but you can take your time. And if you again want to talk with us, okay, or seek a second opinion, you're always welcome, Mr. Jason. Are you getting me?
Okay, doctor. If I want to undergo that test, but later I want to withdraw, will I be able to do that?
Mr. Jason, anytime before the procedure, if you want to withdraw, you are
Do we receive any?
always, yeah, you'll always be allowed to do so. There is nothing to worry about that. Okay. At this moment, Mr. Jason, can I ask you some personal questions?
Okay, doctor.
Mr. Jason, do you smoke?
Very optional, doctor.
Okay. Smoking can be very dangerous for your heart, and it would be very better if you could stop smoking. Okay. If you want, we can refer you to a smoking cessation clinic. Will that be all right?
Okay, doctor.
And do you drink alcohol?
No.
Okay. May I ask you a very personal question, if you allow me?
Okay, doctor.
Do you take any recreational medication?
No.
Okay. And have you ever lost consciousness?
No.
Okay. And okay, so that's all right, Mr. Jason. And may I know that do you like to proceed with our plan, or do you want to take time now?
I want to think again.
Okay, Mr. Jason, you are very much welcome again whenever you want to discuss with us, and you can take your time, Mr. Jason. Do you want any other questions to be answered or any other concerns?
Doctor, if I don't do the test, will I die very soon?
Well, Mr. Jason, if you don't do the test, there will be other test options as I have told you, and we can also get some idea about your heart by doing the tests. Okay, so please don't be so much negative at this moment. There are many treatment options for your condition. Okay, and we will try our level best to treat you as good and as soon as possible.
Time
Okay,
up.
Mr. Jason. Okay.
Okay. So we can proceed. That
Okay.
what was your task?
Actually, my task was to uh, tell him about the diagnosis and also about the management plan, I think, and also about the investigation that I would like to do.
Okay. what was the patient scenario?
Um, he wanted to, as I can see, that he had been admitted with breathlessness, and he wanted to know about his management plan and something like that.
So you aren't quite sure what was the scenario.
Yeah, I was sure, but I just couldn't. I didn't write it down totally, actually.
Okay. So do you think that you have been able to explain this condition?
I think I tried to explain those the condition by drawing some pictures and
Do you
like
think
that.
that you needed to address any other part or any other thing?
I cannot just remember, doctor.
Okay, so we are starting out talking. Okay. First, in the scenario, you have introduced yourself well. You have asked my permission. You have taken the permission that you are going to take some notes, but that will be confidential. Okay, that was fine. That was fine. And after that, you wanted to know how I am. I was fine. After that, I told you that I had some problem with my heart that was diagnosed as childhood. And did I tell you any diagnosis? I think I
No.
didn't tell you any diagnosis. So how did you assume that I have some problem with PhD or anything else, such like that?
Yeah.
You were explaining that I have PhD like that way already.
Yeah. Mm-hmm.
Okay, you at that time you could have asked that. Okay, do you know that what was the diagnosis before? Was there any
Mm-hmm.
diagnosis? Then I could tell
Mm-hmm.
I know or I do not know, or I could tell that yes, I know that there are uh, some a defect in the wall of the heart or anything else.
Okay. Okay.
Okay, you haven't asked that, and without knowing that, you started talking. And also,
Mm-hmm.
patient was advised with cardiac catheterization. Patient told you that she was advised, but she didn't wanted to do the test. Have you ever asked that why don't I may I know that why don't you want to do the test? Is there any specific reason?
Mm-hmm.
Okay.
I didn't.
At that time, patient may have fear, or patient may tell you that yes, I have heard that one person while doing the test suddenly died, or I think it is a surgery type operation, and I am very afraid of surgery.
Mm-hmm.
Okay, there were a lot of questions I could have asked you, but I didn't ask you because there was not time. You lost most of the time by explaining that that was not necessary. Okay. And I also asked you that will it be painful? You didn't give any good answer for that.
What should have I told?
Okay, actually it is a local this cardiac catheterization done under local anesthesia. So just in the femoral vein region, there is just a local injection is given. Okay, just you will given some numbing agent, and during installation of this numbing agent, or during administration, or during giving the numbing agent, you will get some pain, and that is very mild pain. And after that, you will not feel any pain.
Okay.
Okay, I could have asked you that is it a surgery? What would be your answer?
I don't know what should I have I told.
Actually, you should have told me that it is just like an giving an injection, just like procedure that is giving an injection. We are not going to cut anything. Okay, you could have asked first about my fear, why I am not keen to undergo this test. After that, you could get better idea that why I am not. I am not. Yeah, that is called. I am not. Why I do not want to do this test. And after that, it would be very easy for you to manage
Yeah.
me.
That's the main problem in the beginning part when we start
Yes.
doing session
Yes.
4. Actually, that's the problem.
You explained by drawing, and that was totally irrational because you don't know that what is the problem with his heart. And patient didn't tell you that there was problem, and that was totally unnecessary. Rather, you could have you could have drawn this procedure that we are going to enter where here, and it is going to the heart, and we are going to see. That would be better. And your main task wasn't uh, 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 was not to telling him that about what was his diagnosis. Your task was to explain the investigation, purpose of the investigation, why it is necessary for him. Okay, and you told him it in a good way that at this time you are not feeling any problem, but actually this problem is going on, and that can come with a devastating condition later, or it is also the harmful process is going through your heart, and that will in the future bring something very bad for him. That was fine. That was something scary for me, and also that was alarming for me. That yes, I need to undergo through this test.
Okay.
Okay, and at the end, there was a lot of things that you should have you should have told the procedure in a very good way that we are going to uh, admit you on that procedure date, and after that we are going to clear the area. We are going to give you some agent to remove the bug over the area. After that we will give you numbing agent, so you will not feel any pain, and during giving the numbing agent you will feel a little bit pain, and after that we will introduce a wire that will go to your heart, and after that we will inject a special dye to see your heart in a very good way.
And we repeat this, admit that they clean the area, then giving
Numbing agent, after that you will introduce
giving
wire.
medication so that no bug infection. What? So,
Some will clear the we will clean that area.
okay. Then bug infection.
So there will be less chance of any bug infection.
Okay. Then numbing. Okay.
Then numbing, then introducing wire, then dye, then we will take picture of your heart. Okay.
Okay. So
And after the procedure, we will keep you under close follow up if there is any complication develops or not.
Okay. And may I ask that because of introducing diet, should have I asked about his kidney function?
You could have asked about
Okay. When he asked about the complications, what should have I told?
Okay, at first you have already told him that we have good team, so there will be less complication, and even at we will closely monitor you, and even at any time anything bad happens, we will promptly treat you, and we will be ready for that if there is any happen. But again, I am assuring you that we have the good team.
Okay. So that was right. What I told.
Yes, you are assuring me, and I came to know that yes, you are going to arrange something very good for me.
Okay. So any other thing to be added?
And after that, any personal history and occupation and any social support, any economical support if he needs or not, you could have asked.
Okay. That's all right.
Overall, this was fine. Your first attempt. This type of
Can this be fine? I think this was disaster because I just
it was your first attempt. I think it was fine. Okay,
because the problem